Since it started, I think the speakers and things that's been on every month have more or less been really pertinent to our job roles. And it gives you an idea of where to go if you've got certain problems and different things like that. The actual networking part where you can get people's information and emails and what's going on with people's jobs, I think it's probably the only area that you can get that information. And I think being given the chance to actually see other social prescribers from other areas and see what's going on in their teams and how they're working, I think it's just it's really beneficial. And support-wise, it's a good support. And well, I've been coming since it started.
I've benefited a number of ways. There's been some fantastic speakers here talking about movement important for patients and moving that in and making that part of my role, speaking with patients. We've had a great housing association networking meeting, which again has linked me in with lots of different people. So not only does it let me know about different services that are out there that might be missing in my role that I can talk about, it's also linked me in with particular people within different organisations, so I'm then able to connect with them via email and support my patients better.
I think the link worker networker meetings have benefited myself and the whole team. We all do try to attend as often as we can. They've given us information about statutory services, voluntary services, given us a chance to find out how other PCNs work and how different it can be, and to meet other social prescribers.
Social prescribing link worker network meetings have been fantastic for me. I've been back in this role for a year and it's really helped to get me back in touch with the wider social prescribing team, relevant services, public health, housing.
Knowing that I've got monthly network support, knowing that I'm connecting with the other social prescribers in County Durham so we can feed back to each other has been essential for my role because it can be quite isolating. So being able to have that time has been fantastic and still is fantastic. Also having Sue there as a guide and support, she's been brilliant. She's set up extra action sets as well so we can all work together in different areas, so it's not as so much of an isolated role as it was initially at the beginning.
I've been able to access various different types of training that I maybe wouldn't get access to so easily without DCA and the link worker meetings. As a whole, it's a really big part of our professional development and keeping us up to date and up to speed with everything, hence to be able to give our patients the best service possible.
The support's been really useful to us all. It's brought us together, especially the housing conference that we had and the meeting we had a few weeks ago at Living. We now receive a lot of referrals from Living and work very closely with them, and it's given us a lot of insight into the housing and how it works. Sue is great. She gives us a lot of support, meet up with her regularly. Her emails are always very informative and useful, and I think it's just great really. I don't know what we do without you.